Hi, I am Dr. Itsham and welcome to my YouTube channel. Today we are going to discuss about the chest x-ray, and by the end of this video you would be able to read a chest x-ray with confidence. So we're going to discuss the different things like the views, AP view versus PA view. We're going to discuss about the quality of the x-ray, how you're going to find out that it's a good quality x-ray, different zones of the x-ray, how you find out, okay, how you read the x-ray, and a couple of more things including trachea, lung fields. We're going to talk about the ribs, heart, diaphragm, and many more things which we see in the x-ray. So this is an x-ray of a patient. So whenever you are having an x-ray, the first thing you need to do is that you need to determine the details of the patient, that you are reading the x-ray of the right person. The second thing is you need to determine the view, there whether it's a PA view versus the AP view. The PA view, that is a standard view in a chest x-ray, and there are the different three things actually which you can differentiate from PA view from a AP view. In the PA view, as you can see, there are no scapular margins. This is a PA view x-ray, chest x-ray, so there are no scapular margins. I'm going to show you in a while AP view where there will be the scapular margins. This is a PA view. The second thing over here is that the heart size, um, okay, that looks normal in a PA view. If it is normal, so that is normal in a PA view as compared to the AP view where the heart would be magnified. That's why you cannot comment on a heart on a PA on a AP view X-ray. And the third thing is that the ribs, the interior ribs, they will be more oblique in a PA view and they will be parallel in AP view. So this is a PA view, you don't see any scapular margin, the heart size looks normal, and the interior ribs, they are more oblique. So these are the three things which you're going to determine that it's a PA view or the AP view X-ray. I'm going to summarize it again. Yeah, over here you can see this is a PA view, this is a AP view X-ray. In the AP view X-ray, here you can see the scapular margins which I was talking about. That's not there in the PA view, these scapular margins, okay. And heart size, you can see that in the AP view it's bigger, okay, because it's magnified as compared to the PA view. And the third thing was about the ribs, they are more oblique in the PA view. Um, the next thing you see in the X-ray is the quality of the X-ray, whether that's a good quality X-ray or not. And again, here are the three things you need to look for. So the first thing is that, yeah, the quality of the X-ray. The first thing is that look at the spinous processes over here. Okay, you can see the trachea and the spinous processes over here. So this is the medial end of the clavicle. Okay, so this, it should be halfway between the medial ends of clavicles. Okay, the spinous processes should be halfway between the medial ends of the clavicles. This means that the patient's position is fine. Okay, um, it's a normal position and patient is not tilted. What I want to say over here is that, so this is the first thing. And the second thing is you need to look behind the heart. Okay, you can see the vertebrae over here behind the heart. So these were thoracic vertebrae. Okay, in a good quality X-ray, the margins of these vertebrae should be barely visible. If they are prominent, again, you can see them clearly. This means that it's overexposed, and if you cannot see anything and you cannot see the margins at all, this means that it is underexposed. What I mean by the margins is these are the margins. Okay, it's a vertebra and these are the margins. They should be barely visible behind the heart. And the third thing is, for the quality of the X-ray, is that you should be able, you know that, okay, when we take the chest X-ray, most of the X-rays are in full inspiration. So these are the posterior ribs over here. So 8 to 10, and these are interior ribs. Okay, so 8 to 10 posterior ribs should be visible, and 5 to 6 interior ribs should be visible. That's are the characteristic of the good quality X-ray. These are interior ribs which are oblique, or you can see there are almost 5 to 6 ribs are visible over here. um, we said that 5 to 6 interior ribs, and the posterior ribs 1, 2, 3, 4, 5, 6, 7, 8, and here's the ninth one. So 8 to 9 ribs are visible. So based on all what we discussed, this is a good quality X-ray. So up to now we have discussed about the quality and about the views, AP versus the PA view. Now okay, the interior ribs are oblique, okay, and the posterior ribs are sorry, that they are horizontal. They are horizontal. So here what you can see in a horizontal, these are the posterior ribs, and if you look clearly, okay, their interior ribs are oblique. Now next is up to you, okay, from where you start. Normally when I see an X-ray, I start from the trachea, and I see that whether the trachea is central or not. Here you can see the trachea is central. Most of the X-rays, it is slightly on the right side. That is a normal thing. So it's a trachea is a central over here, and you can see here that the trachea is bifurcating into the right bronchus and the left bronchus. So you have seen the trachea. The next thing is you see at the lung fields. Okay, the black, you can see it's air in the lungs. So you look at the lung fields. For the purpose of our convenience, okay, but these are the large lung fields, so you are prone to miss anything. So we divide these lung fields into the zones: upper zone, middle zone, and the lower zone. And these zones do not correspond to the lung lobes. Okay, do not assume that. This is just for our convenience, that we should not miss anything. So what we do is that the first rib, interiorly, first rib, in the second rib, up to the second rib, it's an upper lobe. Remember, okay, it's the interior ribs. From second rib to the fourth rib, this is middle zone, and anything that is below is the lower zone. This is just for our convenience, that we can compare the one side on the other. If you're gonna look grossly over here, you tend to miss the things. You are prone to miss the things. So upper zone, interior two ribs, okay, and that's upper zone. 2 to 4, that's a middle zone, and anything below is the lower zone. And here you can see the costophrenic angles over here. So that makes easy for us, that we can compare the upper zone with the upper zone, and we are focusing more on a smaller zone, as compared to, if you see on the whole lung fields over there, you tend to miss the things. So that's why you need to divide in the zones so that you can see that. So the next thing is that you can see the ribs, which we have talked earlier as well, that the interior ribs, they are oblique, and the posterior ribs, they look horizontal. So these are the posterior ribs, okay, and these are the interior ribs, which are oblique. So you have the clavicle over there. The next thing you can do is to see at the heart, okay, and there is something that is called cardiothoracic ratio. Okay, what does this means? That this is the diameter of the heart, and this is the thoracic diameter. So the cardiac diameter should be less than the half of the thoracic diameter, okay, ideally and normally. If in a PA view X-ray, we don't do that on the AP view, because there the heart is magnified. If this cardiac shadow is greater than half of the thoracic diameter, okay, this indicates a cardiomegaly. Okay, so you can get an idea from an X-ray about the heart size as well. So that's a cardiothoracic ratio. So the size of the heart, the diameter of the heart, should be less than the half of the diameter of the thorax. Okay. So here you can see the diaphragm, the next thing, right hemidiaphragm and the left hemidiaphragm. Okay, and the left side, you know, that's a stomach. And here you can see an air that is called gastric bubble, that is normal on the left side. On the right side, there should be no air. If there's an air over there, that's called air under diaphragm, and that's a sign of perforation. Now the next thing you need to look that you can see air sometimes over here. Okay, there's air under your skin, that is subcut emphysema. Okay, if there's a finding, so you need to look at this as well. Now let's discuss about the heart and the things which you can see on the x-ray, the different chambers, how you can identify on the x-ray. So here you can see that it's a right atrium. Okay, this is the right atrium, which I'm going to mark over here. Yeah, this is trachea, these are clavicles, and these are ribs, you know that. These are posterior ribs and interior ribs which are oblique. This is the right atrium, you can see over here. And this is the inferior vena cava, IVC, and this is the right atrium. Above that, above the right atrium, you can see a little bit superior vena cava, but that's not much evident over here. Now, if you look over here, this is your left ventricle. Okay, above over there, this is the aortic knuckle. Aortic knuckle. Okay, so a curve over here, and you can see a second curve downwards. Okay, that's pulmonary trunk, pulmonary arteries, and this one is a left atrial. Okay, this is left atrium, and this is RV, right ventricle. And this is how you're gonna get to know that what is there in your x-rays. Right atrium, right ventricle, left atrium, left ventricle. The next thing you can see over here is the high lung. That's lung hilum. Okay, that's on the right side, and on the left side it's there as well. So this is about the x-ray, chest x-ray. We're gonna see the pathologies, okay, of the x-ray in the next video. Thank you.